Hello doctors and nurses, this is Alex from Swoosh English, and I've got another video today all about OET Speaking. And you will have noticed that I've done quite a few videos recently because it's so pertinent, it's so important right now for students who have got their examinations coming up soon and who are really looking to crack the examination on their first attempt, so looking to get a grade B in the OET Speaking section. And that's where a lot of students are struggling if they're doing self-study and they don't have someone to give them feedback on their speaking before their real examination. So I wanted to go through a few phrases with you that are really important when it comes to showing empathy to patients when you're doing the role play. So whether you're doing the OET medicine exam for doctors or whether you're doing the OET nursing exam for nurses. So empathy in its very basic form is showing an understanding for how someone else feels. So maybe you're as we say in the UK, you're standing in their shoes, you're seeing things from their perspective and see how they might be feeling. So you're putting your own interests last and you're thinking about the thoughts, feelings, you feel sympathy maybe for another person if they've got a negative situation that they're dealing with right now. So a few phrases to kind of put this across and to show that you have concern, you have sympathy, you have understanding for the patient. For example, you could say, say if a patient has had an heart attack, or you're speaking to one of the family members about the condition of their son, daughter, their cousin, their brother, etc. You can say, I can totally understand how upset you are right now and how you must be feeling. You could even go one step further and say, for example, I can totally understand how you're feeling because the same situation happened to me last year with my father, with my mother. I can see how upset you might be, but I just want to point out, there's no need to worry because there's a really high success rate with this procedure. Or you can say we've got a really good success rate of patients recovering from this illness. So, you don't need to worry, excessively because we've helped so many of the people before. Something like that can really show, and you really need to put that across in how you say the words. So your intonation is really important. So the reassurance is important because a lot of patients you're dealing with, a lot of their family members as well, will be really anxious. They'll be really worried about the situation. Maybe, like I said, I talked about a heart attack, or maybe their child has got asthma, suffering from asthma, and maybe they don't know much about this subject. So they'll be really anxious, really worried, concerned. For example, in one of the role plays that the OET put out from a few years ago, they talked about a little 5-year-old boy. You're speaking to the parent of a 5-year-old boy who's just recently been diagnosed with asthma. So the parent is not sure what asthma is, and they're wanting to know, is this going to be long term? What happens if he has an asthma attack? How do you deal with that? So they're very worried. So you really need to calm their nerves down. You need to let them know that everything's going to be okay, that they are in good hands with you. So you really need to show that. And in some of the speaking mock exams that my team and I have been doing recently here at Swoosh English, we've noticed that a lot of candidates find it difficult to show empathy, to show care. Maybe in their mind they're thinking, how upset they are for the patient or for the family, etc. But maybe they can't express it in the language that they use. And language is really important if you want to get a grade B in speaking, but also the intonation as well, and really getting that across. And really be careful as well. I had an OET Speaking examination, a mock examination today with one of our current Swoosh English students, and they talked about asthma and then talked about the fact that don't worry, we can get an ambulance to you whenever your child has an asthma attack. So immediately the patient, the family member is thinking, ambulance? Really? I don't want my child to have to go in an ambulance. The word, even just the one word ambulance, really could scare parents. Could scare family members. So you really need to be careful with your selection of words as well. So this empathy is very, very important. So be careful with the words you use, because you could unnecessarily worry, frighten any family members or patients who you're speaking to. So be really careful to reassure them. Of course, you need to give them the actual facts, and, don't say to them everything's going to be okay when it's not, but you can talk about minimizing what they can do to minimize the risks of a procedure, an operation, a condition, a disease, whatever that might be, by the use of, about the language selection that you use. So like I said, I can totally see things from your perspective. I can't imagine how you must be feeling right now, maybe the pain you're experiencing, or I can't imagine the stress and the trauma that your family are going through with your little boy who's just been diagnosed with asthma, and he's having a tightness he's got tightness in his chest. He's having difficulty breathing. If it was my child, I would obviously I would rightly be concerned, just as you are right now. But don't worry, because we are here to support you in any way possible. So you can see that I've got genuine concern and concern for the welfare of this patient. So really put that across. It's really, really important. Hopefully that has been helpful to you today. I'll be continuously giving you different phrases that you can use to show empathy, to show care and understanding to the patient when you're doing your speaking mock exam role play. As I've mentioned previously, the best situation would be for you to get a native English speaking OET teacher, so you can practice with them. They'll play the role of the interlocutor, and you can get that feedback, corrections for improvement, or suggestions for improvement, corrections, grammar mistakes, better selection of language, reassurance, an estimated grade as well would be really, really useful to you as well. And in the next case, get a study partner as well, so you can each play the different roles. One person can play the patient, one person can play the nurse or the doctor. If you'd like any more if you have any more questions about today's video, make sure you put them in the message box below. And if you would like to if you'd like to download our free 3-part OET video series, make sure you go to swooshenglish.com. So I look forward to helping you.